Management training for medication pass computerized. Correcting mistakes that should not exist in the world of medication administration. By Elizabeth L. Holden, LPN. Problems that need corrected. Preventing the problems. Going back to the basics. Reasons for the change. What it means if things are not fixed. And keeping it simple, Sam. The problems that are occurring. As managers, you realize that they're not checking the medication allergies, they're not confirming dosage amounts, or confirming patient is the correct patient. Basic needs to correct problems that should not exist. What is in the Pyxis, the pharmacy medication dispensing machine, is not the dosage that needs to be given. Remember, the training that got you here. The 6 rights. As nurse managers, you know the right medication, the right dose, the right patient, the right route, the right time, the right documentation. And of course, the 7th is the right for a patient to refuse. Any mistake here means that there is a med error. This is basics. These came out of the Fundamental of Nursing, Potter Perry textbook for the first-year nursing students. And as nurses, you know these were drilled into you hard and heavy. Okay, we're looking at a calculation formula. The right dose. This means looking up what the med is and the normal dosage. If the correct pill size is not available, calculate the dose. You've got what the doctor ordered, what you have on hand, you divide it, and that gives you the pills given. So that makes it simple, but you've got to ask questions and you've got to make sure you stay at the basics. Doctor's roles. To ensure the proper medication is prescribed along with the dose for the patient. When the doctor is writing the prescription, he needs to ensure all of these things are correct. The drug being prescribed, the dose, the form, whether it's tablet, liquid, capsule, patch, route, how it's being delivered, how often, once a day, twice a day, and the doctor's signature. He also needs to make sure that the allergies are checked. Needs to make sure he's writing for the right person. Remember, he's human and is well and overworked. What if something is not right? Preventing problems are great. It's okay for a nurse to question a doctor about orders, or a floor manager can do this. Questions allergies if seeing the patient has problems with certain drugs. Dosing, if it seems too little or too much, question it. Doctors are human and do make mistakes. Medication and supply. What is on hand does not mean that is the dose that needs to be given. Pharmacy orders what is available or easy for them. The fact that they have 1 milligram prednisone tablets does not make it the right dose. Know what is common dosing factors. It's part of our jobs. Mistakes that are ignored or skipped because of fear or assumption still strips a person of their license. Giving to the wrong patient. Your nurse should be performing triple checks when pulling medication. When comparing MAR to drug to patient, and again to confirm right dose. Excuses, there are none. We as nurses or nurse managers know what it takes to become a nurse. The computer is put into place to assist, not think for us. Trying to decipher handwriting is the reason for the change. Taking advantage. Doctors are great, but they are rushed, overburdened, just as we are. We need to work together. Systems update. Font sizes will change. Number of pages to read will be less. Remember, this is better than reading a handwritten prescription. Is this what you really want to try to decipher for 8 to 16 hours a day? Or using the computer? Which is it? It's up to you. Change works. Reading computerized prescriptions are easy. Thinking is not as hard as reading that and deciphering the writing. Screens and print will get better. Remember, change causes change, so computerized medication pass and prescriptions will improve. Remember what you were taught. Questions. What can you think of to ask to make things easier to make this change work? Okay, please ask any and all questions. Thank you very much. These are the references where I was able to pull up material. even though all the material laid out was common knowledge for a nurse. But there's not always just nurses or doctors looking at this.